All right, I think we'll go ahead and get started. Thank you everyone for attending today's session on ending homelessness in North Dakota. We have Cody Schuler with the Fargo-Moorhead Homeless Coalition presenting. Just a couple of reminders, please keep your videos and your microphones off during today's presentation. If you have questions, please type them in the chat box and he will leave a couple different question periods throughout his presentation. Also, if you are needing a certificate of participation, please contact Marilyn and she will get that sent out to you. They're only sent out for those that request them. So if you need one, please contact Marilyn. On that note, I think I will turn it over to Cody.
Hey, thanks, Kylie. Remind us how much time we have today.
Till 2:30.
Oh, perfect. Okay. Yeah, indeed. Welcome, everybody. Thanks for having me again this year. And I always like anytime I get a chance to hang out with Kylie because she's a fellow Dakota Wesleyan Tiger. I think, are we the only two in the state at this point that went to Dakota Wesleyan?
Oh, probably.
Probably. I don't know what the alumni situation. We didn't go at the same time because I'm old, but I was enjoy getting to do stuff with you, Kylie. This is great. I really appreciate the opportunity to speak with you all today. I'm going to talk about ending homelessness in North Dakota, obviously from a Fargo perspective, since that's the coalition that I represent. But we're all in this together across the state, and we are today, as we get started, as Kylie said, I'll leave room for some breaks. Also, if you have questions, you can also unmute or even turn your camera on if you want when we do some of those questions, and we'll be able to get through today. So again, thank you. So as I said, ending homelessness with, and I guess I call this presentation data, systems, and policy are the three areas that we'll kind of touch on today. And we'll just we'll get moving here this morning, or this afternoon, I guess. So just a quick little introduction about myself and the FM Coalition to End Homelessness. We were founded in the late 80s, really as a coalition of 4 shelters that were working together to deal with a rising homeless issue in the Fargo-Moorhead metro community. And those 4 shelters at the time realized that they needed to work better together. And so what they did is they came together and started a coalition mainly for just meeting that immediate need. As time went on, the coalition did grow into other homeless service providers and became a forum for collaboration and partnership in addressing homelessness in the area, mainly with a mission to increase and improve services. And then as time went on, coming into the 2000s, we really saw the coalition grow to a mission of ending homelessness. And so for the last number of years, probably since around 2006-07, somewhere in there, our mission really has been to work in partnership to achieve permanent solutions to prevent and end homelessness. And we work towards that mission through advocacy, education, and through collaboration. Some of the ways that we do that, I'll just kind of highlight some of the work that we do. We have our advocacy arm of the work that we do. That's at city, state, federal level, doing public awareness, hosting our Homeless Memorial Day every year, doing other education events that we can do in the community, anything to raise awareness, presentations, we do poverty simulations and those kinds of things as well. We also then, from an education standpoint, believe that we're not going to end homelessness unless we're all rowing in the same direction. And so we've tried to work really hard at building out trainings that support those efforts. And so everything from our basic homelessness courses to specialty courses, doing our SPDAT trainings, having our annual conference, which is actually tomorrow, and being able to work even with our partners so that we're even doing education, not just here in Fargo-Moorhead, but wherever it's needed. So we do things like host the CARES Lunch and Learn. That's for our CARES network. That's for all of North Dakota and all of West Central Minnesota. It's really powered by them. They're the ones who really provide us with what we need, but we host it and be able to provide that for others. And we also take part in hosting the online trainings for the region as well. That's really, again, a function of the COC, but we partner with them because we have the staff to be able to do that, and we're also using it locally. And then we also collaborate. We provide a collaborative table for us to be innovative. We try to do research and data, which you'll hear about a little bit today later on. Doing lots of committee work. We're the local CARES lead partner, so we host all the CARES committees for our community. We have our Landlord Risk Mitigation Fund, as I said, our State of Homelessness report. There you'll see those 4 ladies are the women who were part of the core of designing our medical respite program, which was that and the care system were a great part of how we became a Bush Prize winner here at the Fargo-Moorhead Coalition. And so collaboration is really the heart of what we do from our founding. So advocacy, education, and collaboration. This is just a slide that you can just kind of ignore. We meet monthly, and for our local folks, this is a slide that I use a lot of times with community groups of how to get involved, because you can do everything from getting involved in a committee or a work group. We have a really robust collaborative space for people who want to be a part of the mission. That can be an individual or an agency. So this morning or this afternoon, as we head into what we're going to talk about, I thought I would frame us today, because you're going to hear not only my organization's name, the FM Coalition to End Homelessness, but that's the heart of our program today is ending homelessness. And so what does it mean? Let's make sure that we're all talking about the same thing. What does it mean to end homelessness? Because there is a functional or virtual end to homelessness, and then there's an actual end to homelessness. An actual end to homelessness means that homelessness no longer exists, that no one becomes homeless ever. That's a very lofty thing. There are a couple of European countries that have set that as their target and are well on their way. But really in this country, when we talk about ending homelessness in the United States, we are talking about making homelessness rare, brief, and a one-time experience. People are always going to have homelessness. There's that you could lose a tornado could hit your house. You could have a fire. If you don't have any other place to go, you would find yourself to be homeless. Our goal then is to build out the systems and the policies to be able to say that when homelessness happens, that it's not happening often in our society, that it's rare. When it does happen, it's very short term, and that it doesn't ever happen again to those individuals. And so here at the Fargo-Moorhead Coalition, we really recognize that while we are made up of a lot of different entities and agencies around our community, our metro area, and then out into our state partners, into Minnesota, over into North Dakota, we have all these partnerships, and we recognize that a lot of that is service-based. But when we try to do this macro work of not just meeting immediate need, we go to this 30,000-foot level. And so we have to think about the work of social justice, that we are fundamentally a human rights and social justice organization coalition. And so therefore, we have to think about charity and justice. So if you'll just bear with me for just a minute, to kind of think in black and white terms, or in this case, blue and blue with white in the middle, blue on the ends and white in the middle, to be able to think about how we defined what charity and justice is. So I'm going to make some paint with a broad brush here, but just bear with me to make the point. What is charity? When we think about charity, we think of charity versus justice. We think of charity as being more on that direct service realm, right? These are the things that sometimes people will call bandage work. It's direct response to suffering. It's oftentimes a very individual nature of that kind of work. We can think about this examples of us living in society. We oftentimes donate food or clothing. We have shelter. We have, maybe you can volunteer in a soup kitchen. We have organizations that are providing either as individuals or as a service to the community, building housing. We can get together and we can organize benefits and provide medical services. We can do all sorts of things with donation. We think of, our church does the annual pillow drive for the shelter. We think about how we sign up to do something individually. That is oftentimes more on this one side of the screen, this charity idea, that we are meeting immediate need in the same way that when someone gets hurt, you put a Band-Aid on something as a preparation to heal, you're meeting the immediate need. Over here, we're doing charity kind of in that category. So then what is the work of justice? Well, the work of justice then becomes broader work, higher level work. It is very much social change. So we're thinking advocacy work, right? Changing root causes of suffering, getting down to where the suffering is coming from, where it starts, and then moving from there into actually solving those issues. We're looking at things that are systemic, structural, institutional. So examples would be, we as individuals can do things like contacting our elected officials, doing legislative advocacy, maybe on some larger things when we think about different issues in society, maybe it's where we're spending our money. Could be a way to make change. Advocating for corporate policies and practices. Maybe we're participating in boycotts. Maybe we're doing community organizing, or even being a part of nonviolent vigils or direct actions, even civil disobedience. We think of the civil rights movement and how some of the work was moved forward by civil disobedience and being able to make a statement in that way. And so we think about making change, meeting immediate need versus making the change at the root cause. I often tell the story when we talk about this that some of you may have heard, but the story of the village that discovered there were a lot of babies drowning in their river, or in the river by their village. And they didn't know where the babies were coming from, but they built an amazing response system to rescue the babies and to adopt out all the babies, until finally somebody gets fed up and decides to go upriver and says, I'm going to find out where the babies are coming from and I'm going to make it stop. When we're looking at homelessness, we need to look upriver, upstream, and say, what's causing the homelessness? What's causing poverty? What's causing these issues? And we want to make it stop so that we can have the best shelter system in the world, and that's not going to stop homelessness. Oftentimes I say, we're not going to cure cancer with an emergency room. We cure cancer with research and treatment, and even dealing with root causes. What's causing cancer? What are the things in our world that lead to that? And so we have to kind of think about the same way. We're not going to end homelessness with just shelter. We're going to end homelessness by being able to address those root causes. And so that'll be a little bit of the backbone of what we talk about today. Also, just a housekeeping thing that I forgot, for those of you with your Zoom, to go up, you can, if you're seeing the slide and me and a bunch of faces in the gallery view, or however that works for you, you can select that speaker view. That might help for others. I've gotten a text here from someone saying that they were struggling. So go ahead and do that if you need to. So going back to this idea of justice versus charity, again, somewhere in the middle, charity meets justice, and that's where a lot of us live. We're working on the bigger issues, and we're also meeting immediate need, but we have to think about that continuum, that if we think black and white about some things, we see charity and justice, but somewhere there in the gray is where we're really getting the work done. So think about it this way. Here's reality. We got 3 people watching a game. One is getting more than they need, right? So that they can't all see over the fence, and so some people have a big elevation, right? They can see the game. Some get just the amount of help that they need, and others actually have less. They're even in a worse situation. So what we do is we try to, in the work that we do, we try to seek out equity. We try to have everyone benefit from the same support. So what we do is we offer things, but if we're offering things equitably, not everybody is going to be helped in the same way. So what we try to do with equality, so what we try to do is what's called equity. I misspoke there. We're trying to get to equity so that everyone gets the supports that they need. You can see the first guy, he doesn't need any supports, so he can see the game just fine. The second person is getting the proper amount of supports. They just need a little bit of support. The third one needs a lot more support, and he gets it. That's what equity looks like. We talk about equity in our systems quite a bit. But and that's a goal of the social services that are needed in ending homelessness and addressing poverty. But at the end of the day, what we're really trying to do is reach a place of justice. That is, that the barrier is removed so that all can see the game without supports. But that means that we need to be able to address all of the inequality and equity across the board. The systemic barriers need to be removed. Again, sort of the focus of where I'm going to take us today in talking about the work that we need to do. So here at the Fargo-Moorhead Coalition, we center the work that we do on the UN Universal Declaration of Human Rights. Article 25 declares that everyone has a right to a standard of living adequate for the health and the well-being of himself and his family, including food, clothing, housing, medical care, necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or lack of livelihood circumstances beyond its control. That long mouthful is the backbone of the work that we do. Article 25 and the guaranteed human right to housing and these other services is where we find the inspiration for what we do when we go to design and look at advocating in social policy and the way that our local homeless response should be, is all based in this idea, this belief of housing being a human right. When we do this work, we know that it's really hard. And I always like to quote President Obama, who actually is quoted, is embedded in there as a quote from June Jordan, that we are the ones that we have been waiting for. We are the ones that provide the change that we seek. When we look at the work that's before us, we have to recognize that we are the ones. We are the ones. A voice is a human gift. It should be cherished and used to utter full human speech as possible. Powerless and silence go together. Margaret Atwood reminding us that when we step onto the sidelines, that we are just adding to powerlessness, right? When we are silent, but rather we have a voice to use. So I just wanted to encourage everyone to be able to do that, to be a part of this work beyond those immediate needs. Now, I know all of us on this call today, some of you are in direct services, some of you are in various different aspects of social service work. And so my empowerment, or what I'll empower you all today, is to be thinking about how you connect what you do on a daily basis to being that larger change. Because sometimes we can get a little bit lost in the hard, busy work of the quote unquote, the bandage work, meeting the immediate need, and being able to figure out how we then fit into the larger social justice scheme of things. So I'm gonna back up a little bit and just talk a little bit about why there is homelessness. Because that's, if we're trying to make homelessness rare, brief, and one time, and we're trying to address homelessness in this way, I want to be able to help us connect. If we're going to look upriver and say, let's get to the causes of homelessness, then we need to lay out what they are. So before we do that, I'm just going to take a quick question break here. We have a question in the box. North Dakota Rent Help client who is approved for homeless, trying hard. So we here at the Fargo-Moorhead Coalition do not do any direct services. And so you need to, if you're looking, depending where you're looking for services here in the Fargo-Moorhead area, and we try to encourage this across North Dakota, that folks use 211 as a place to find where the appropriate resources are to connect in your community. And so here in the Fargo-Moorhead, we do that, and it's connected to our homeless response. We at the coalition, like I said, we're doing that advocacy and collaboration work. And so we're not providing anything directly. We're only doing referrals. And so our referral would be then to contact 211 to find the appropriate responses to that person's issues. It says that he's in Fargo. Yes, shelter, you can call any one of the shelters. We'll get to this a little bit in the homeless response system here in a minute, but here in the Fargo-Moorhead area, yes, if you call one shelter, you're on the list for all the shelters that are appropriate, and yes, 211 can make that referral to be able to do that, or if able to find one of the shelter numbers, the shelter would be able to do that as well. All right. Okay, we'll keep moving here along. So why does homelessness exist? Well, there's no one reason other than not having a home. Homelessness can be because of a natural disaster. It can be systemic and personal issues. It can be beyond a person's control. Sometimes personal choices can lead to that result. Sometimes it's an issue of personal and systemic issues. So when I talk to different groups and talk about homelessness, we say, well, there's really no one reason other than someone who doesn't have a home, because there's so many reasons why you could. However, we have something in this country called systemic homelessness. And so what's facing us is that we see, while homelessness has always existed, we really do see in this current time, in this day and age, for the last couple of decades, a growing mass of folks who it's not just the people falling into homelessness and needing to be pulled out of homelessness or be helped out of homelessness, but actually generational homelessness, generational poverty, and seeing sort of a systemic problem. So if we're going to talk about that, Daniel Weinberger in The Causes of Homelessness in America states these three reasons that we see systemic homelessness in the United States. First one is the rising housing costs and the transformations in the national housing market. We have a housing market that systemically contributes to homelessness. Second, the lack of relative expansion in the government safety net and the inability of social service programs to keep pace with increasing demand. So essentially, when you consider, I'll use example in the state of Minnesota, some advocacy work that our coalition participated there. They increased the cash MFP, which would be their welfare program in Minnesota. The cash assistance in Minnesota had not changed in its monthly amount since 1983. And it was 2018-19 before the legislature finally and the governor's budget actually changed that amount. And so things changed dramatically in this country since 1983. For instance, I grew up, graduated from college, and went to graduate school and became a professional person, all in the same time period that people that were on cash assistance in Minnesota were getting the exact same. There was actually one woman who was an advocate. She was the director of the state Minnesota coalition. She and her mother were on cash assistance as a child, and she said now she has a family member who was on cash assistance. She said she's getting the exact same amount in 2018 as they did in 1983. And so the safety net isn't catching up. And luckily we were able to change that in Minnesota, but changes all over the country have not necessarily kept up. And then the pervasiveness of a socio-political norms and attitudes that stigmatize the homeless in the policy sphere and thwarts the efforts of homeless service providers like you and me to meet the needs of the homeless population. That's a fancy way of saying we have a real poor attitude among our lawmakers and decision makers about poor people. We have a poor attitude about poor folks. And so that just really translates into a massive struggle of not being able to address the two bullet points above. Carrying along on that same theme, going to maybe go into a little bit more depth in talking about a couple of things, still a little bit in the abstract, but let's think about what's changed in this country. So we're no longer warehousing people. Once upon a time, people were put into institutions for various reasons. We don't do that anymore. That's fantastic. That was an important move that we made in this country. However, the services have not kept up with. So while we're not warehousing people in institutions, we don't necessarily have the community-based resources. Part of that safety net and other reasons have not kept up. So that includes inadequate mental and behavioral health resources. Our state is not alone in that. I would say that we have made some strides in the last few years, but we are far from being adequate in this state. Nationwide, we've seen a loss of public housing over the last 40 years. We've really gone from not really building and maintaining public housing, but rather we've made a shift. Now, every one of these things, these shifts, like it's great that we're not warehousing people. On the flip side, what has it created? We've not kept up with the need. Same thing with public housing. So we take away public housing. That part of the reason that public housing has diminished over the years is because we've moved to the housing choice voucher. That's better for folks to be able to have the opportunity to have client choice, to be living where they want to live, to not live in congregant settings or housing projects. And at the same time, that means that we're relying on the free market to provide housing. That means we're relying upon private landlords to take those vouchers. And so we have less control of who's able to be housed. And so with having that loss of public housing, we lose an important resource in this country of sort of filling the gap between the loss of institutions and not having those pieces there. If you're relying upon the free market economy, you're at the mercy of the landlord, of the private landlord. Whereas if we had that public housing, might have been more places to sort of catch the in between. Now, I'm just making a critique, not saying that we should necessarily go back. Maybe there's different solutions, but I'm trying to name some of the things that have happened that have brought us onto this through that trajectory. Next thing would be the living wages versus a housing wage. We just don't have always have the wages in our communities for people to even be able to afford housing. A little bit later, I'm going to talk about that. Economic systems that favor the wealthy. We've seen tax cuts and various things that definitely favor. We know that, and so just to sort of be on the train of what you hear a lot of talking points in the media, when you have multi-billionaires pay $0 in taxes, and you have somebody living on $40,000 a year paying in their fair share, we see this a lot of income inequality, and then that going into our tax system as well. And so our entire economic system, if you have money, you can make more money, or you can be able to maintain certain statuses. When you live on the margins, you don't have those same opportunities. And so that is that's a part of the system that is contributing to this issue that we need to be able to talk about. Then also, we need to acknowledge systemic racism and historical trauma. When we look at persons of color and their experience, when we look at racism, we know that racism exists in our communities. And without getting too political, particularly following our special session last week, we need to be able to talk about where race is in the system. Racism is not just an individual thing. It is built into our systems. We have many years of research and evidence that can demonstrate that. We have to acknowledge that there are people of color in this country, particularly Native Americans, who have experienced historical trauma that has changed the trajectory for them as a people. And we need to be able to acknowledge those things and how they fit into acknowledging systemic homelessness and poverty in America. What role do those things play, racism and trauma? So all of those pieces, when we start looking everything from when we stopped warehousing people and the changes in public housing and affordable housing in this country and the lack of the social safety net, and we look at economic issues and we look at racism, we have to acknowledge all of those pieces that bring us to where we're at. Now, what I've done is I've made for you a really big whiteboard of things that we need to address, and it's probably overwhelming, which it is, which is why we need to take a breath and try to move forward. Oh, and I almost forgot, also the justice system. We have so many people incarcerated in this country, and there's really a lot to be said about who we're incarcerating and the damage that does for their lives. We know that there's racism in our justice system, in that what whites and blacks tend to use and sell drugs at about the same rate. However, we see a higher percentage of, say, African Americans, for instance, in jail for drug use and sale. And so when we look at those pieces, we have to look at where race plays a role in that, and how that's damaging lives, and how that is playing a part in then homelessness on the larger scale. So we put all of these pieces together. Also, we have personal responsibility in the midst of all this, and so we have that economic system and personal responsibility, and that comes together here in our finances. Studies have shown that here in this country, we're not good savers. Now, some of that's because people aren't able to save because they have don't make a lot of money, and then other people don't make it a priority. I'll put myself in my own category. I will tell you that for many years of my life, I was not a good saver. And to be honest with you, I became a really good saver during the pandemic, because guess what? I wasn't going out to eat, wasn't going out and doing entertainment things. And so all of a sudden I had more money in my account. And while I've not dipped into those savings, I've noticed my budget change a little bit now that, varieties of things have changed after the vaccine, where I definitely have done more of those things and I've spent more of that money. And so I've even looked at my own finances and said, before the pandemic, I might have actually been one of these people. And I'm a middle-class person with a full-time job as an executive director of an organization. And so I say that to not be judgmental towards any of those of us on today or that we work with that fall into these statistics that are on your screen today, that many individuals do not have enough money to survive a short-term emergency. If we add into the fact that a lot of people maybe don't even have the resources and the social network to fall back on these things or to be able to ask for help from a friend. I'm very fortunate. I have parents that I could call and say, hey, I'm not going to be able to make rent this month. And they probably be able to help me. If I got evicted, I could probably crash in their basement. And so I have different resources in my life than some others might. And so this financial precariousness that we find our as individuals in this country contributes to this issue as well. This is from the National Low Income Housing Coalition, and just wanted to share, I've got 3 slides from them here. And if you'll just take a look at it, I'm not going to go deep into it because it's there's a lot to digest here. But if you look on their website, you can see the website there on the bottom, nlihc.org/gap. You can find all of these resources that you're going to see here. And we take a look at it and say, here we've got those households that can't afford, can afford. You see that as you look households by income category against the units that are available. Just let you all digest that for a little bit. Like I said, I'm not going to go into it because there's a lot of information. But then to look at it a different way, here we look at our cost burden renters by income. And all of this is pre-pandemic. A lot of this research is hard to be kept up on. And then lastly, I wanted to show, be able to show the, again, also from 2019 stats, what it costs to, how much money you need to make in order to make rent, 2-bedroom rental. Here in North Dakota in 2019, that number was needing to make $16.65 an hour. In Minnesota, it was 19. And so we can see there was also, and I didn't pull up that slide, but it also showed at minimum wage. I believe in North Dakota, it's something like over 80 hours at minimum wage, 40 hours a week in order to make rent. So what we're seeing is just sort of evidencing those gaps and the problem that is before us. That's a systemic thing. It's not what you and I are doing in the shelter or what we're doing on the ground every day. We actually are looking here at that bigger systemic issue. Taking this last slide here from the National Low Income Housing Coalition. So the US has a shortage of 7 million rental homes affordable and available to extremely low income renters and households. And so what's the solution? Well, we need to increase investments and rental assistance programs. And I think that COVID has shown us, and I'm going to show you a slide a little bit later, that perhaps some of the COVID efforts have actually demonstrated this case in point. But ultimately in this country, we have a housing issue that needs to be addressed. We need to be making those investments as well. So I'm going to transition then for us to talk about some actual things that we're doing. So I've tried to name the problem for us a little bit today, wanting to be able to then talk about what we're actually doing from a practical. With that pause, if there's any questions, I'd be happy to take any. I see another one in here in the box. When was the last time the government took a look at Section 8 vouchers and did some changes that are actually helping people? I think that program, administration to administration, is being looked at. I will tell you that right now, Senator Kramer of North Dakota and Senator Chris Coons, Democrat of Delaware, are co-sponsoring a bill that's actually working its way through Congress currently that would cut some of the red tape on the side of inspections and being able to get those vouchers used faster, and would also provide landlord, set a mechanism in place for landlord in incentives. The only reason I know about this piece of legislation is because I was one of the individuals and some of our coalition partners that were consulted on that by Senator Kramer's office. And so essentially looking at being able to incentivize those landlords and to make those housing choice vouchers more usable in certain areas. I think we have a long way to go. One thing that is being proposed by the Biden administration is the idea of a universal housing voucher, essentially making it an entitlement program. So instead of, for those of you in housing authority world, instead of having your wait lists and we've got X number of many and we ought to open up the list, et cetera, it would just go to if you qualify by income, we'd have enough, you would automatically get a voucher. Now, does that help with housing stock? No, we're still relying on the free market housing economy to be able to then use those vouchers. But one of the barriers that we could lower would be to make a universal voucher available with those housing choice vouchers. So I think that there's ongoing evaluation. I think that the change and progress is very slow. If there aren't any other questions, I'm going to keep going here. So how are we ending homelessness? Well, ending homelessness takes a variety of things. First of all, it takes shelter. It takes services. So we need all of the pieces in place. We need to have adequate shelter. We need to have all of enough housing online. We need to have the supports. We need to have those other resources like behavioral health online, recovery. All of those pieces need to be available in our services. Then we need to have the systems in place. So we need to have access to the systems. We need to have assessment and assignment. Assessment means that we're using tools in order to assess the needs of individuals, in order to prioritize our resources. We need to be able to have mechanisms that people are being connected to that housing. And then we need to provide ongoing support services to keep people housed when we get them housed. Getting people housed is oftentimes surprisingly an easy thing to do. Keeping them housed is where things becomes really, really challenging. So I say all of this to say that this also then needs to be that we're using evidence-based best practices. It's not a bullet point that I'm going to show you today, but using and adhering fidelity to model on, for instance, for housing first. We've seen over 30 years, the data has proved that the housing first philosophy is the best practice for us to use. However, it doesn't work if we only kind of sort of use it. We need to be able to pair that with harm reduction. We need to be able to, sometimes we think we're doing housing first, but then we do things like require people to be in programs. That's not fidelity to model. And so we need to be able to talk about that, and we need to look at our systems and make sure that we are using best practices, using things that are evidence-based, and that we have all the pieces of the system there. Because if we don't have those stabilization pieces in place, we're going to head right back to shelter or back out onto the street because we don't have everything in place. Another thing that we're going to need to end homelessness is funding. We have to have the resources. Everything that I just described takes funding. And then policy. We need to be able to put the policy pieces into place. We need to strengthen things that would help end discrimination. Yes, we have fair housing policy in this country, but is it working? Is it being adhered to? We need to look at all of those economic pieces that I've described. What can we change? You know, I'm not saying we should change minimum wage in this country. Well, I mean, I personally believe that, so I will present that as one option, but I think we have to look at that. What does wage look like? What can be done about policy on that? What can happen down in Minneapolis? They just approved rent control. That's one of the things that they're going to use to try and keep housing affordable. Not saying that that should happen here. I'm saying we need to look at all those solutions. What are the policy pieces to try and solve those issues that we've just named? So then going back here to that second piece, systems, how are we doing it? Here in North Dakota, we have the coordinated entry system as a responsibility of the North Dakota Continuum of Care, which has entered into partnership with the West Central Minnesota Continuum of Care to have one coordinated entry system that covers, as you can see there, all 8 regions of North Dakota and 3 small parts of, 10 counties in Minnesota. Minnesota has 10 continua of care. North Dakota is 1 continuum. And so but we see here with our across the Red River Valley partners, the need to be able to work together, particularly here in Fargo-Moorhead, because our shelter system and our services are constantly bouncing back across that border. But what has happened by doing this partnership has really brought us to have a very high standard of the way the system should work, even though every community doesn't have the same resources and doesn't always have the same system. The policies are in place to enforce housing first, to enforce other practices of fidelity, and to be able to help local communities provide templates, but also empower local communities to respond in a systematic way. And so we have that through the coordinated access, referral, entry, and stabilization system. So as we go forward, what is the crux of coordinated entry? Yeah, it's nice on a map. Looks great on a map, right? That we have this, oh, look, everybody, if you're homeless in Williston or Jamestown or Bismarck or Devil's Lake, it's all going to be the same, you know, in theory, yes, but also no, because we know those resources are different. So what's the crux of the CARES system? Right here you have in front of you a variety of some little stick figures that are representing people experiencing homelessness. All these individuals are homeless, but they are not a homogeneous group. These supportive housing programs are all serve persons who are experiencing homelessness, but not every program is identical. And so what our coordinated entry system does is tries to match the unique needs of individuals to the unique programs and services that are available. So regardless of what resources are available in the community, we're looking at the individual and we're trying to connect them with the appropriate service in their community. And also because we have a network that's statewide or region-wide, we actually have the opportunity of client choice to be able to move around within that system with proper referrals. So if someone has need in Minot and that need can only be met in Fargo, we can make that proper referral. Gone are, or should be gone, the days of just putting on people on buses and sending them and not even making a phone call to the shelter where you're sending them. But rather, we now have an actual system where we should be able to do it. Is it always working the way we want it to? No, there's a lot of room for improvement. Have all the pieces of the system been built out? No, there's still some gaps in the system, but we're working on it. Here's at a high level of the way that the coordinated entry system should work. So we have people who are in a housing crisis. They access the system. They are guided then to the right place. Maybe they can self-resolve. Maybe they just need a food basket. Maybe they need some light touch. Maybe they actually need to get into shelter. We want to get them into the appropriate place. Not all shelters are created equal. Here in my community, we have multiple shelter options. Some are better than others for certain individuals and their needs. And so we'd be able, for instance, just someone's fleeing domestic violence, right? They might need something different than someone else, than a single male or a single male with a child. And so we have the process then of screening people through that access to shelter, to self-guided. Maybe they get then moved over into assessment assignment, go through the system to be able to be triaged to the best programs for them. And once housed, being able to be stabilized. Any questions about the coordinated entry system? This is a broad map sort of what the model should look like. Not every community is going to have all of these pieces, but it is sort of the way the system has been designed. If not, knowing that we have about 15 minutes left, I want to talk about data. I want to talk about what ending homelessness looks like with using the data that we have available to us. I'm going to move pretty quickly through this, maybe to provide a little extra time for some questions. But every year here since 2019 in the Fargo-Moorhead metro area, we have been we've been putting out a state of homelessness report. For many years prior, we participated in Minnesota's every 3-year Wilder study, which was a point in time count that was very in depth and very time consuming, and they only did it every 3 years. We realized that with our Homeless Management Information System, or HMIS, and other community data collection points, we were able to analyze and look at how we're doing. What's our report card on how we're ending homelessness, and be able to put it out and present this to the community every year. And over a period of years, we're able to actually see trend lines. When you do something like the Wilder study or our pit count every year, you get a snapshot. We wanted to be able to look at data that actually could be analyzed and trends could be seen so that we know if we're actually ending homelessness or not. So back in June, we released this report, as we have for the last 3 years. And essentially what you see here is the goals that we have laid out to be rare, brief, and one time. We say the system, which I pointed out in that CARES chart for access, assignment, assessment, and stability. And then where are we collecting what are the data points that we're collecting in those 3 categories of rare, brief, and one time to prove that we're making progress and to show that we're ending homelessness. Our care system is our homeless response, and so most of these data points are being collected through the care system. There's a few other places. So on any given night in the Fargo-Moorhead metro area, we have 989 individuals experiencing homelessness. Now, this number is the only number I'm going to share with you today that is not a hard number. This number is taken in 3 ways. Through a variety of services in our community, we have identified roughly around 100 people on any given night that are unsheltered. So in 2020, in the year 2020, we were able to sort of identify 95 as a semi-hard number. We know that there are 393 shelter beds. That does not include some of our overflow, et cetera, but that's our hard number. And we know our shelters are always full or over capacity. So we know that that number is a reliable number. And then in working with our school districts and a few other places, we've been able to identify at minimum around 500 individuals who are doubled up with friends and family. We believe that number to be quite a bit higher actually. But as far as those that we could identify with confidence and make an estimate that way, and we bring these numbers together to arrive at this place. So you can see that in 2019 versus 2020, that number varied a little bit, but not by much. And so we know that right now we're in the ballpark of around 1,000 on any given night in our community in Fargo and Moorhead. And then we use that number, but we actually have hard numbers that we break down in our report, which is available online if you want to look at it. And so this is where we sort of how we communicate to the community what homelessness looks like in our community. And we hope that over time, this guesstimate number will continue to trend down along with a lot of our hard data. So then we break down who is experiencing. Now, these numbers are hard data based on those who have been served in the Fargo-Moorhead metro area. All of this information is coming from HMIS. And so you can see there, the majority are working age adults. You can see there that those who are chronically homeless, also majority working age adults. Here we can see that who is experiencing homelessness by gender. You can see there, one of the interesting notes that we have is when we move into gender of the youth population, we see more transgender or gender non-conforming individuals being identified. If you'll see there, it's a very small slice of the adult homeless population. It grows in our youth population. Again, all these numbers self-reported into HMIS by those who are being served. And then experiencing homelessness by race in our community. As you can see, Fargo-Moorhead metro area is around 80 to 85% white. But we see only 51% white in our homeless population, and that 89% there are identifying as that 9% are identifying as Hispanic or Latino. And so we see what this shows us, that there's a significant racial disparity among the homeless population compared to the general population in our metro. This would be true across the state. However, I don't have that data for you for any of these points. This is just our what we've done to make, how we've pulled our data and put it together to look at what's happening in our community based on who's being served in our services. This also comes from HMIS. This is one of my favorite graphs that we use every year. We used to have to do this by self-reporting. Every 3 years, we would do a survey, and it was very labor intensive to get the information to make this graph. We're now able to pull this from HMIS, and we can see the complexities. We have these co-occurring conditions that significantly increase when we look at specifically at those who are considered chronically homeless. Just take a moment to take in this graphic, and all of this is online in our executive summary if you want to look at it further. But ultimately, if you really take a hardcore look at that, you can just see how when you look at it's not just one problem or another, but these problems layer on top of one another, and that 9% of our population are experiencing mental health issues, chronic health conditions, and substance abuse disorders. 9% may not seem like a lot, but when we start actually looking at who that is in our shelters, it's really quite a lot of individuals. And then, of course, I'm not even touching on all those other places of overlap. This is just a little comparison chart from 2019. It's basically roughly about the same. And then this is kind of a hard one to explain. I'll just mention that through the VI SPDAT, the housing assessment tool, in 2020, we had 21% of individuals who were assessed who identified some sort of trauma as a part of their reason for currently being homeless at the moment that they were assessed. Now, the reason that I call this in is that in 2019, it was a staggering 58%, and that drop is also staggering. We really believe this to be something having to do with the pandemic. We're not able to put our finger on it yet. And we're really interested to see what our 21 numbers look like, to see if it goes back up closer to that 58%, because that 58% actually, while staggering, really does follow tradition a little bit more, or the trends from the past years. So we think this might be a little bit of a pandemic anomaly, but we'll take a look at it next year to see. Still, when we think about going back into all of those causes of homelessness, the fact that not just those systemic issues, but that current trauma has such an impact on why someone might be experiencing homelessness right now. When surveys have been done over the number of years here in our community, this is not HMIS data, this comes from community surveys that we've done, we see a lot of barriers to housing. Oftentimes, people are homeless because of evictions, their inability to pay, they've lost their job or had hours cut. Barriers to accessing housing, you can see there. None of these would probably surprise you. Ability to maintain housing, seeing a lot of the same things, and the same thing with employment. And here is our cost burden. So this is a really interesting stat that we take a look at in our community to really show that those lower income levels really do struggle with more cost burden. So some of those national statistics that we looked at earlier actually bear out locally. Now, recognizing that I'm right about at the end, there's one little section to our annual report that we expanded upon this year, and that's our cost savings. I wanted to do this one first, and then I'll do that, and then we'll wrap up with any questions. So pressure on our system. If you can see here, I'm going to use my mouse to show. So if you'll notice with our entries and exits, 193, 399, 425. And then we saw in 2020 only an increase of 38. We saw this dramatic trend down. We really believe that to be not only the moratorium on evictions, but also the amount of assistance dollars that were put into the system. Remember earlier when I said that I would reference later on that we think we know it works and that we maybe have some evidence showing that? Here we have that right here. We believe that this, and we're going to continue to research this, but we really believe that this is the first sign of evidence that we really can address homelessness with those proper resources that prevent people from becoming homeless in the first place. Lastly, and I'm going to really direct you to spend a little bit of time if you want to go look into this in our report, the cost savings. So I'm not going to go into overly into the details. I'm going to go jump right down. Our housing navigation program here in the Fargo-Moorhead area, in studying individuals that they work with, these are the kinds of savings that we're seeing, or the drops in usage when we take a look at pre-housing versus post-housing. So looking at reduction of ambulance rides, reduction of emergency rooms usage, emergency shelter use, jail time, detox, and this shows on the Cass County and then also in the Moorhead detox side. Dramatic drops in detox usage. And so what happens is we see these when you're housed, you're using less services. Looking at this across the board, this amazing drop. Here you can see by dollar amounts. And so you can see particularly these emergency room, we're seeing a drop from $300,000 down to, just under 100,000. Now this is only for 20 participants being measured over the last few years. And so what we've seen is over $1.5 million in savings to our community through just housing 20 chronically homeless individuals. So I want to give my thanks for everybody there and bring us to the end. Thank you all for listening to me prattle on here for an hour. If there's any questions or anybody would like to engage in a little conversation, happy to do so, especially since I rushed through that last part. If you go to fmhomeless.org and you go to one of our drop downs, there's actually a full page for the State of Homelessness report. And you can take a look at the executive summary or the full page report, which is like 60 some pages. And you can take a look at some of those pieces. What I'll say is, as a closing remark, is that ultimately I named for you all things in society, issues of social justice that we need to address. And then when we actually come into our services and we actually house people, we have the proper funding and supports, and we make the difference in individual lives, we start to change the systems as well. So it's not just political action, it's also doing the hard, what we taught the bandage work, and moving it towards changing lives and systems. And so we can see that when we invest in these things, we're not only doing the right thing for individuals, we're also saving our community money. We're going to pay for homelessness one way or another. I would rather pay for it towards the goal of housing as a human right and serving people and keeping safe and healthy and in our communities and making them a part of our communities in whole and healthy ways, rather than just doing nothing and leaving people on the street, which is actually also then from an economic standpoint costs us more. And so that's my closing today. I'm really glad to have had the opportunity to be here. And like I said, if anybody has any questions, I know Kylie, we're right out about time, but I'm happy to hang out a little longer, even if you turn the recording off, if anybody wants to ask any questions.
Yeah, we'll give it a minute or so. If, like he said, if somebody wants to ask any questions, just please unmute your mic and we'll go that way today. Just a reminder too, before everybody signs off, if you need a certificate of completion, please contact Marilyn and she will get that sent out to you. Also be watching for the survey link to come out later today. Please give any feedback and any possible future topics for our next go around, which will start again in the spring. We have a few weeks left of this go around. So any topics that you guys think would be good would be great. It looks like Vicky has a question. I did not understand the map with the 1, 2, 3, etc. What did it mean?
So that map, and it's not easy for me to pop back to it, so I won't refer back to it. But the map, that is the state of North Dakota, being a large area, a large geographic area, is broken down into 8 subregions, and so each one of those regions has a human service center, has a community action agency, and as well as regional homeless coalitions. And our coordinated entry system is also then broken down, and our COC is broken down into those regions. And so it doesn't follow the county excuse me, the county service zones anymore, but it really does follow, like I said, community action and the human service centers. And that map really represents, so region 1 is Williston, region 2 is Minot, region 3 is Devils Lake, region 4 is Grand Forks, 5 is Fargo, Jamestown is 6, Bismarck is 7, and Dickinson is 8 as the hub cities of those regions. And so we have that as our map. Minnesota doesn't have the same system, but our partners in West Central Minnesota are broken down into 3 areas: the Moorhead, which is basically a part of Region 5 in North Dakota, and then we have the 2 other regions, West Central and Mahabiatwa in Minnesota. So it's really just sort of how we break down. In order to end homelessness, we have to have a planning system in place, and you can't plan very well at a state level. You have to plan around where your services are. And so each and every one of those are those breakdowns in that way. And so yes, the human service centers, there's the human service centers in those 8 regions, and then there are the zones which are the old county services. And so there are not 8 of those, there are, I believe, 19. And they are just another layer of systems on top of there. So that's a different map. But we're really looking there at the main human service centers, community action, and our regional homeless coalitions that also then are the backbone of the coordinated entry system. So that's what those breakdowns are. And any other questions? I'll say if anybody is interested in policy solutions, we're always looking for individuals. I think sometimes people get a little scared about policy, but policy isn't just calling your legislator. It's actually getting together and saying, I'm an expert in what I do. I do this in the housing system. So I'm a housing case manager. This is what I do every day. Or I'm a shelter advocate. I'm doing this every day. And so then you take your expertise of your professional level, and then you can sit around a table around somebody like myself who's not. So I'm the one who's a little bit more comfortable in the policy realm. I don't know as much about some of the on-the-ground social services. I'd make a horrible case manager on many different levels. But I need the case manager to help me understand how we're going to write policy, or what we're going to ask lawmakers to do differently, or to be able to assess where the gaps are at. And so if you're interested in making those kinds of changes and essentially being the expert in the room. I've always said, I've got a lot of folks in our coalition who said, oh, I don't want to do this. Going to the Capitol scares me. You know what? That's only going to the Capitol is only the small part of it. We don't know what to ask for if, I don't know what to ask for unless you tell me. And so we need to bring all those pieces together. Perfect example, in North Dakota, we were able to get some legislation and some other policy changes made around how youth access medical services in the state, and how they access their birth records when they don't have a parent to sign for them and they're underage. That all happened because for over a year, we worked with a national consultant under some grant dollars to research what other states did, to analyze our state policies and state laws, and then write up the corrective action and actually take that to the legislature. One of those things passed the legislature. The other one, after testimony was presented, the Department of Vital Records actually said, you know what, you don't have to take this to the legislature. We can fix that in-house. We didn't know it was a problem. And so we were able to actually change that. But it took years of folks like yourselves who maybe aren't interested in some of the policy stuff to tell us what was wrong and to think creatively about solutions. And then those of us who work in the policy sphere take that across the line. And so it really does take all of us, even if you don't think of yourself as a policy person. And anybody who's interested in that kind of stuff, always give me a call, because we're not the only ones working on it. There's folks all over the state, and we'll try and connect in the best ways possible.
All right. Well, thank you so much, Cody, for presenting again.
Hey, and thanks, Kylie. Next year, I'll try and cut out some things so that we can have more room for questions and stuff.
No, it was great. Thank you. Again, thank you all for attending today's session. Next week, we are taking the week off due to Thanksgiving. The week after that, we will have the presentation of North Dakota Rent Help. So hopefully you all are back for that. hope everybody has a wonderful Thanksgiving, and we will see you, or kind of see you, on the 30th. So thanks again.
Okay, thank you all.